Hi everybody, I'll be talking today about pharmacovigilance in palliative care. So we all know that dying from disease is sometimes unavoidable, but dying from medicine is unacceptable. So always take care by not giving too many medicines and creating damage to the. So what exactly is this pharmacovigilance? Most of you are aware by this time. Okay, so this is detection where you are going to identify the adverse drug reaction. You are going to assess it. You are going to understand, analyze, and you take measures to prevent the adverse drug reactions in the future. So this is just to differentiate between adverse drug reaction and adverse event. Adverse drug reaction, always there is a causal relationship between the drug and the reaction, whereas adverse event did not necessarily have a causal relationship. So this you should always keep in. So why this pharmacovigilance? So we are all aware that in phase 1, phase 2, phase 3, all the phases, if you put together the number of participants who are involved in this particular new drug development, it will be around maximum 4,000 to 5,000. So when we start extrapolating these results into the total population, the incidence of small adverse effect which occur during this clinical trial may not be detectable. So those reactions has to be identified. That is the whole purpose of phase 4, that is a post approval, that is called as pharmacovigilance. So if you look at this in the pre-marketing studies, you can find that number of patients are only in dozens, hundreds, rarely in thousands. Okay, length of time, usually it is for short time. We do not take into consideration pregnancy, children and the elderly. Then other treatments are avoided. So no concomitant medication and the doses is fixed and the patients are followed rigorously. Okay, so this is what happens in the randomized control trial. But in real life and in palliative care, they are suffering from multiple disease, multiple medications they are taking, and they are always at risk of developing the adverse drug reaction. So I'll be concentrating more on the palliative care because that is the other part, the regular pharmacovigilance, most of you are aware, but mainly regarding the pharmacovigilance related to palliative care, I'll be. So when we take more number of drugs, always there is an increased chances of hospitalization and cost. Okay, so one thing which I want to stress here is, as far as the pharmacovigilance in palliative care is, the people who are taking the drugs are, most of them, they are serious and they are at high risk of multiple medication. Their body functions are altered. So PKPD, everything is altered. And many times these adverse events are easily mistaken. So we cannot identify whether it is a disease symptom or it is because of the adverse event. So that challenge is always there for the palliative care physician. So if you look at the drugs which are very commonly used in palliative care for pain management, we have got a few drugs. This is the drug formulary which is usually used in palliative care. This is the labeled drugs. Okay, apart from this, there are plenty of drugs which are used off label, especially in palliative care, because many times they go for individualized therapy, whichever is suitable for the patient. So why it is crucial in palliative care is because already I told you it is high risk population, multiple conditions, altered organ function, weight loss, and they will be taking too many drugs. That is first thing. The second thing is symptoms overlap, especially fatigue, confusion, constipation, all mimic to that of a adverse drug reaction. And the other thing is impact on quality of life. Okay, so these already suffering patients, and if you add a more number of drugs with more adverse effect, this can increase the suffering, making symptom control harder to achieve. Okay, so as far as the evidence of pharmacovigilance is concerned, there is very limited evidence for this palliative care medicines. So these are some of the examples where the symptoms and the drugs almost mimic, like fatigue, anxiety, dry mouth, and the corresponding drugs also make certain important contribution in the development of these symptoms. So what needs to be done? You should continuously assess them systematically, specifically ask about any potential side effects which Sometimes patient may not volunteer, so you have to inquire and identify. You keep reviewing the medication, whatever has been administered, and try to go for deprescribing instead of stopping unnecessarily. And the data has to be collected appropriately. So use a proper structured data collection tool so that if sufficient data is available to the real world, okay, so people will be aware of what type of adverse effect they can anticipate. So always focus on the net benefit. So even if the risk benefit ratio has to be considered here as far as the drugs are concerned in palliative care. So what is required now? We require a constant vigilance. That is always we have to look at the safety first. Okay, so should take utmost care. So how do we do this? For this we have got what is called as a good pharmacovigilance. Any adverse drug reaction event, normally we do treatment. Apart from treatment, we should also start reporting. So as far as the new drug is concerned, we all know that periodic safety update reporting, it is a law. And for the old drug, it is basically the responsibility of each of us. So all the academicians, practitioners, they should cooperate in reporting so that necessary action can be taken. What needs to be reported? There are plenty of reaction which most of the time people tell that I already know this, I have seen several cases. Okay, so whenever you are in doubt, golden rule is any suspected reaction to a drug, whether or not you are certain the drug caused it, so just report it. So there are some high priority which has to be compulsory reported. They are called as serious adverse drug reaction, unexpected unlabeled reactions are there, new drugs compulsorily all adverse drug reaction, any reactions in special population, reactions due to drug and food or drug medication errors, and even related to quality also. Okay, but there is something called as a mild or known reaction which most of the consultant keep inquiring is, yes, report them, especially if they are more frequent, if they affect the adherence of the patient treatment, or if they occur in vulnerable patient, they appear more severe than expected. Okay, so in such cases, even the mild reactions has to be reported. So who can report? Any person who is involved in the healthcare marketing authorization holder, nurses, pharmacists, anybody can. This is the suspected ADR form, and this is the yellow card which in the UK they follow whenever you administer any drug. They also give this drug, so immediately patient can report it. That is called as voluntary reporting. So whatever the report you submit, either in the form of paper or in the direct pharmacovigilance local person or through mobile, so everything goes to the national database, and from there it goes to the international database. So what next? Do not stop at this level. So you should always see that you are going to disseminate whatever you will come across through CMEs, publication, conference, so that other palliative care physicians are also aware and they do not make any mistake of repeating the same medication. How do you report it? There are multiple tools available for ADR reporting. Okay, either through the mobile or helpline or suspected ADR form, or you can visit any of the ADR monitoring center. So the dictum is, when you suspect it, report it. Okay, so with this I conclude this palliative care. So the one important information which I want to share is, okay, the symptom, if it subsides with the drug, then it is because of the patient symptom. If the symptom increases with the administration of the drug, that means it is because of the adverse drug reaction. So you should know how to discriminate between the drug reaction and the patient increase. So thank you very much.